Before starting dental bridge treatment, be sure to tell your dentist what kind of treatment you want in terms of aesthetics and function, your concerns and expectations. Treatment is completed in an average of 7 days and usually requires 2 clinic visits. Anesthesia and tooth cutting are performed at the first appointment. Your dentist will numb the teeth that need to be reduced during bridge construction with a small anesthetic. It cuts your teeth to a slightly smaller size on all sides and prepares a place large enough for the porcelain veneer to sit. Then, measurements of the teeth are taken. A negative mold of your reduced teeth is taken using a special impression paste. Your dentist may use this mold to prepare your permanent teeth or may make an appointment for you to get a new mold a few days later. Cold sensitivity often occurs in reduced teeth. In order to prevent this, your dentist prepares a temporary tooth or crown after taking measurements and attaches it to your reduced teeth. In this way, your teeth and gums are protected until the permanent restoration arrives. At your second appointment at the clinic, your dentist easily removes the temporary bridge tooth and checks the relationship, closure, color and form of the new bridge. In some cases, this rehearsal may need to be repeated several times to obtain the ideal forms of the teeth. Bonding of the bridge tooth. After the successful fitting phase, the corrected areas on the restoration are polished and permanently bonded to your teeth. Bridge therapy is a scientifically accepted treatment method and the main priority is to provide benefit to the patient. Your new teeth can be prepared in just 2 appointments and within a week if the area where the fixed prosthesis will be placed is suitable. With good oral hygiene, they can generally remain in the mouth for 10 to 20 years. Bridge teeth replace your missing teeth and offer a natural and aesthetic appearance. These treatments are one of the simplest and most successful treatments in dentistry. Dental bridges eliminate the aesthetic, chewing and speech disorders caused by missing teeth and are very comfortable treatments for the patient. In order to use your new tooth for a longer period of time, we recommend that you pay attention to dental bridge cleaning. To maintain your dental health, it is important to brush your teeth twice every day and floss, especially before bed. Don't forget to clean all of your bridges and the bottom of your gap teeth using a toothbrush or special brushes. Be careful when placing the dental floss by slowly sliding it between your natural teeth and your support teeth, being careful not to damage your gums. You should also avoid hard foods over long gaps and not use your teeth to cut, open lids, or break anything. You can take more care of your dental health by reviewing your diet and habits. This video is for informational purposes only. We would like to emphasize the importance of consulting with your dentist to determine which treatment is most suitable for you. If you find our videos informative, please do not forget to like and subscribe. Wishing you healthy days.